Hi everyone! I had case study 95, which talks about open angle glaucoma. Mr. BL is a 45-year-old African American male who has a 4-year history of open angle glaucoma. He has presented himself to his ophthalmologist stating, "I think that my glaucoma is getting worse. I can't see nearly as well as I did a month ago." He also complained that he lost peripheral vision in both eyes and there is an occasional blurriness in the center of his right eye. For several years, the patient was managed by his ophthalmologist, who prescribed him timolol in both eyes 2 times daily. The patient also received a bilateral trabeculoplasty about 20 months ago, which was successful. It was used to treat the elevated intraocular pressure in his eyes, which was caused by his open-angle glaucoma. His intraocular pressure in his left eye was reduced from 24 to 17 millimeters of mercury, and in his right eye, it was reduced from 27 to 20 millimeters of mercury. However, within a few months, his intraocular pressure was elevated again. He was placed on several medications, but nothing seemed to be effective until he was placed on dorzolamide, and the patient's other ocular history includes nearsightedness or myopia and the occasional dry eye. The patient smoked 1 pack of cigarettes per day for about 20 years until he quit 5 years ago, and he denies any alcohol or illicit drug use. The patient's medical history includes the occasional monthly migraine and bipolar disorder, which has been successfully treated with lithium. The patient also had his tonsils removed as a child. BL is married and has lived with his wife for 18 years, and he works full-time in the maintenance department at a local beef packaging company. He has 4 healthy brothers and 1 daughter and son who are also in good health. Both parents have hypertension and glaucoma, and the patient is allergic to codeine and penicillin. According to the physical examination, the patient has no heart, lung, gastrointestinal, urinary, or circulatory problems. BL's vital signs appear to be normal, except his systolic pressure is a little high and his diastolic pressure is a little low. The patient's eye exams show several abnormal findings. His visual acuity in his left eye shows that he can only see hand motion at 5 inches away with corrective glasses, and his right is 20/40. The left eye's intraocular pressure is 24 millimeters and the right eye is 20 millimeters. Likewise, the right eye's disc appearance whitish with cupping and pallor and has a CD ratio of 0.70. His left eye appears whitish with cupping and pallor as well and has a CD ratio of 0.89. Although the patient shows no evidence of macular edema or cataracts, and his lenses are clear and his irises are both round and have no other abnormalities. The patient's blood tests reveal that the patient's hemoglobin, chloride, and bicarbonate levels are higher than normal, but the rest of the results are normal. In conclusion, the patient is suffering from open-angle glaucoma. There have been several questions that were brought to my attention regarding this case study about open-angle glaucoma. The first question asks, which of the following pathophysiologic processes occurs first in the pathogenesis of open-angle glaucoma? The first thing that would occur is elevation in intraocular pressure. Second, obstruction to the flow of aqueous humor, and last or thirdly, exaggerated cupping of the optic disc. Question 2 asks, why are some beta-adrenergic antagonists contraindicated in patients with asthma? Bronchoconstriction can occur, especially when taking non-selective beta blockers when administering them to asthmatic patients. Therefore, non-selective beta blockers are contraindicated in patients with asthma as well as those with COPD. The last question asks, why are some beta blocker antagonists contraindicated in people with heart failure? Beta blockers are contraindicated in patients with heart failure because they have the potential to worsen the condition. That's all the time that we have for today and all the questions that we have for this week. Please feel free to post some more for next week's case study.